Welcome back at 7:45. Experts say mental health illness has become an epidemic in the United States. In 2021, nearly 42 million Americans reported seeing a therapist on a regular basis. And as more people look for support, it's important to remember to find the right therapist for you. And joining us this morning to get some insight is University of Holy Cross mental health professor, Dr. Roy Salgado. Good morning. Happy to have you here. Let's just start right into it. How do you find the right therapist? What are the first steps?
Well, it's important to identify what your presenting issue is and then find the right therapist for that issue. Just like with general practitioners in medicine, there are individual therapists or counselors that specialize in particular areas. So there's some that specialize with children and adolescents doing pediatric therapy or counseling, others that specialize with eating disorders, perhaps marital therapy. So it's important to find the right professional with the right credentialing and the right specialization.
So it might be some trial and error. You might see a therapist, realize it might not be the right one, and then you go and find a different doctor.
Absolutely, and it's important to do your homework, to perhaps call, to vet, to ask the appropriate questions, ask how much experience they have and how much experience they have in a particular given area, and see what their areas of expertise and training might be. Some have crisis intervention training, some not necessarily so much, others with eating disorders, others with couples counseling. So it's important to vet them and ask the right questions in that initial interview call.
Yeah, that's a good point, to ask those important questions. I found it interesting in some of the statistics that you sent over. There's a lot of people going to therapy these days. It's almost nearly doubled just within the last decade. Let's talk about that.
Yes, one of the most interesting things and wonderful things that has happened is that the stigma is no longer there as it once had been. Even just 20 years ago, there was a stigma. There was a belief that people who had chronic mental illness are the only ones who could benefit from therapy. But individuals find that individuals who struggle with everyday type of situations, be it just daily stressors, relational issues, that these are things that highly trained mental health professionals can help the individual work through and find solutions to what they're facing.
Yeah, and I think part of that is we're seeing a lot more of it discussed on social platforms, whether that be social media or even in TV shows and movies. We see characters taking advantage of going to therapy, kind of making it a more something that's more normalized versus the stigma that you just mentioned. Why do you think it's difficult for some people to find a good doctor?
Well, just like anything else, if you just call someone in the yellow pages, I'm dating myself, I'm referring to the yellow pages. If you just go
I know what they are.
you go and you look through and you just find someone and you just make an appointment, that's probably not the best way to go. It's going to be really important to vet the individual, to call and find out if that individual is a right fit, mainly because of their area of expertise with the presenting issue that you are going in. And it's important to be able to do that so you can go and be more invested in the work you need to do and do the actual work, because therapy is only successful if you do the work.
That's right. That was going to lead into my next question. What is the goal of going to therapy?
Yeah, the goal is to identify the presenting problem and find a solution for that presenting problem. And the only way that can happen is if you do the work. Whatever the prescribed intervention is, the behavioral modification, the cognitive restructuring that a therapist might assign to you has to be done by the client or the patient. It's like going to your general practitioner. If they prescribe medication to you or say that you have to eat less and move more and you don't do it, the doctor can't lose the weight for you and can't help you get healthy yourself. You have to do the difficult weightlifting and do the work.
All right, got to put in the work. Dr. Roy Salgado with Holy Cross University. Thank you so much for being with us this morning. Some really good and helpful information.
My pleasure.